Dr. Todd Ellerin has been a regular part of News Center 5 through this pandemic. He's an infectious disease expert at South Shore Health, and he joins us live right now. Doc, we're going to throw a lot of numbers at you, but I know you can break it down. Globally, confirmed cases of COVID-19 over 12 million. More than half reported in the last 6 weeks. A quarter of those cases in the U.S., more than 1 million of those cases reported in less than a month. With all of that, do you think we have a good handle on this virus?
Good afternoon, Ed. Unfortunately, the answer is no. Think about it. The U.S. population is less than 5% of the global population, and we're making up a quarter of the deaths globally. So if this were a baseball game, we'd be in about the second inning right now, and the virus is winning.
But Dr. Todd, what about here in Massachusetts? Because the percent of positive cases here in Massachusetts, it really has been steady. I mean, we say it every single day, just at around or under 2%. So are we the outlier now?
Hi, Maria. Massachusetts is doing really well. We have one of the slowest virus transmissions in the country right now. But remember, a few months back, we were, number 2 or 3, so things can change. We are doing very well right now, and it's because of the infection control prevention measures that we've all been doing in the community and in the healthcare system.
So given that, what are you looking for change? What indicators are you looking at for change? And let's just, drill down to Massachusetts. What are you looking for?
Right. I don't want any change yet, but what we're looking for, if things are getting worse, is going to be probably clusters of cases. We have to stop the virus before we have hot zones. Clusters are first. If we see that, we have to test widely. We have to get the positive patients out, isolated, and then trace their contacts. And anyone positive needs to be quarantined. Anyone who's a close contact of a positive person, quarantine. Those are the type of measures.
The WHO acknowledged that the virus now can be transmitted through aerosols, and we continue to talk about this because it's concerning. Tiny particles that can be suspended in the air when people speak or expel air. So does that change our infection control practices, or is this something that they still need to look at?
Yeah, it's something we're learning more about. What's important to note is these aerosols may be suspended in the air for a couple of hours after an infected person leaves the room. We still don't know if that contributes to transmission, but I think it's more important than ever to mask, not just when we're outdoors, but when we're indoors, and especially for vulnerable populations. Keep that mask on as much as possible.
All right, before we go, you want to say it, Ed?
Why don't we both say it together? 1, 2, 3.
Congratulations,
Dr. Ellerin.
Dr. Ellerin was among those honored earlier today by the Massachusetts High Technology Council, receiving the Frontline COVID Heroes Award given to healthcare heroes all across the state for dedication to care of those infected with COVID-19.
Way to go, Doc. Congratulations.
Thank you, guys. It's my system, not just me. Thank you.
Nice job. And we do appreciate the insight that you brought today. So
Always.
Take care. Be well.
Be well, doctor. Thank you.